Professor Sharara has been discussing the modern management of Clostridium infections at the conference. Professor, what's new in this field?
Over the last 10 to 20 years, we've had a global increase both in prevalence of the condition, but also in the severity of the condition and associated mortality, especially in older individuals, but sometimes even in young individuals. So this has become an important issue from a global public health perspective.
What are the drivers of that increase?
It is primarily partly related to a change in the bacteria virulence factors, but a lot of it really comes back to us in that we have possibly abused antibiotics in the community, especially a type of antibiotic called fluoroquinolone, a class of antibiotics, but also because of maybe less than perfect infection control practices, and of course hospitals becoming areas where you have a lot of sicker patients and they mix together.
What's the extent of this quinolone resistance?
It's actually become an increasingly important issue, especially, for example, in parts of Europe and in the United States. It's not really a worldwide phenomenon yet, but because of abuse, again, of these fluoroquinolones, the number of strains that are resistant have increased. Two in particular are very virulent and result really in worse outcomes. So it's important to recognize the risk factors and to diagnose the disease early and treat it early.
What practical steps could be taken in the immediate future to address this issue?
So there are two important things that we really have to keep in mind. One is antibiotic use and stewardship of antibiotic use and diminishing wide use of antibiotics for viral infections and so on. So limiting antibiotic use, because that's the primary driver of resistance. And then the second important thing is really infection control practices. We have to be very diligent. This particular bacteria, for example, the spores of it are not killed by alcohol. So cleaning our hands with alcohol when we go in and out of the room is not enough. We have to use either chlorhexidine or wash our hands with soap and water. So we need to do a better job in infection control practices, but also in antimicrobial stewardship.
Professor, thank you very much indeed.
Thank you.